You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. And according to my first guest, he says nobody should be wearing a loose-fitting denture. He is Chicago's go-to implant dentist, Dr. Alex Short. Dr. Short, welcome to the program.
Happy to be here.
Okay, good. Now, I know you brought a stack of photos, so we're going to try to get to as many of those as possible. Now, for people that don't know your dental implant center, like who's the typical patient?
So the typical implant patient, I would say, doesn't really exist as one person. They're usually categorized into two groups.
Okay.
Our first group is people that have bad teeth, have bad gums, have bad breath, infection, and they may be headed towards losing more teeth, or they may have a denture in their future. And the second group of patients who I'd really love to see, we could probably help them the most, is people who already have dentures. These are people who typically have already gone through the process of dentistry. They've already had all their teeth removed, they've had all that infection removed and cleaned out of their mouth, and they are currently wearing a denture that may be ill-fitting or that they're unhappy with. And for those people, we can give them teeth in one day. They can come in with their denture and leave the same day with teeth.
So they come in with no teeth and walk out with teeth that day?
Yes, they come in with...
Is that rare?
It's actually more common than you would think. It's actually very common. We've done hundreds in our office and at both of our locations.
For denture wearers?
For denture wearers. They come see us in the morning with their denture and they leave that afternoon with teeth in their mouth supported by implants that do not come out.
So correct me if I'm wrong. The way dental implants are typically done is in two different locations, or three. You go to one place where they do the implants, another place where they put the teeth on top, and a third place where they maintain them. You do all three parts. Is that why you do it so quickly?
Yes, that's exactly why we do it so quickly. Most dentists will start by getting these cases and these patients in front of them and then sending them to the oral surgeon. The oral surgeon is then responsible for placing the implants and then getting them back to the dentist where the teeth will be made and placed into the mouth. That is not a same-day thing. Sometimes it could take up to a year or even 2 years. For us, we've traveled all around the US and outside of the US. We've learned from the best. We've taken some of the courses from some of the strongest, most innovative teachers in the field of dentistry doing implant surgery at the highest level possible. So by doing that, we invested in our lab. We invested in the digital x-ray machines that increase our protocols, our workflow, our efficiency, and we are able to, in one day, take you from wearing a denture and placing those implants, printing them out the same afternoon, and you leave.
When you say printing, like a digital printer in your office?
Yes.
That makes the teeth?
We have 3D printers in our office that through our facial scanners, we're able to send those files directly to the printer. 30 minutes later, we have the teeth in our hands. You are waking up with teeth in one day that do not come out.
That's not how it's typically done?
That is not how most offices in the United States do it.
Okay, good. Now, we talked about denture wearers. Are there, in Chicago, are there a lot of denture wearers?
Well, Chicago's the third largest city in America, Randy, so I would assume that within 100 miles of my office, there's probably 1 million denture wearers because there's 30 million denture wearers in the United States.
That's so if it's so good, then why aren't they all doing it?
Well, there's also a caveat with denture wearers, right? Like these patients, they don't really come back to the dentist. They've had all their teeth removed, so they believe that they're no longer in need of dental care. They have no more pain. They have no more infection. They have their teeth until, that is, the dentures no longer fit or they get loose or they feel like their face is getting smaller.
Why is that?
Well, it's not that the denture is getting larger, it's that because your bone is actually starting to dissolve a little bit. The teeth held that bone in place, and now that all those teeth...
So they have to make bigger dentures?
Well, you need to get your dentures refitted. And I think that's another thing that a lot of these patients do not understand, that it's not a one and done fix. It's not. Dentures break, dentures get loose, and as a matter of fact, they may even start to realize the truth about dentures. And the truth is that they are not permanent solutions and that they alter your impact to eat.
Yeah, but isn't it true though? I mean, if you've been wearing a denture, like let's say 10, 15 years, you can't do this because you don't have enough bone.
That's not true. And the reason why it's not true is because maybe in someone else's office with someone else's skill set, that is true. But with today's dentistry and today's workflow, digital technology, printers like we discussed, it's very possible. There are special types of implants even that for patients who have minimal bone or extreme bone loss that can still get the job done. In fact, I have a patient who's wearing dentures for 22 years, most of her adult life actually.
Okay.
And she was told in her town by her dentist, who she saw her whole life, that she did not have enough bone for dental implants. And that led her to wear dentures for 2 decades. 2 whole decades of her life. Most of her adult life, she wore dentures. She did her research, she found our office, she lives 7 hours away from us. And we were able to deliver her teeth that do not come out in one day. It's actually one of the first photos I wanted to show you today.
Let's take a look.
Here you go. So this is Jody, and Jody was like I said, 2 decades in dentures, and she started to not enjoy the foods she loved anymore. She couldn't eat them. She couldn't bite a salad. She couldn't eat steaks and pizza. She was avoiding family events. Didn't go to her 4th of July parties.
She tells you this?
Told us this, yes.
Okay.
We did a smile design visit. She was looking for something very youthful. She was looking for something that would kind of give her her last 20 years back. She didn't like that her dentures kind of seemed like short teeth and didn't follow her lips and stuff. So if you can look at this picture, you could tell that we kind of
that looks good.
crafted it to her lower lip. We made them very round, oval shaped to kind of bring some youth back into the smile. And we didn't want to make them too, far forward or too far back. We really wanted to follow from the side angles too, that this teeth naturally fit the curvatures of her face. This was custom designed. It was not luck. We did this. We tailor-made this to her facial features. And now she can eat and chew whatever she wants. She eats Caesar salads all the time. She told us last time she was in for her maintenance visit that she ate medium rare steak and pizza for the first time in almost 30 years. And now she literally cannot stop talking about what she eats, which is a great thing. But patients don't realize this, that with dentures, they think when they get them initially that these are teeth. You can do what you want.
And they might eat with them.
Right.
I know a couple denture wearers. They never complain.
Well, they don't complain to you, right?
Okay.
Because some dentures may work well for the first year. Now, there are studies that show that within the first 4 years, you lose 60% of the original bone mass following your teeth removal.
So they get loose.
They get loose, and
Is that right?
and your face gets smaller. So then you're in this perpetual problem.
Your face sinks in.
Yes.
When you say small.
Yeah.
Okay.
You're in this perpetual problem of, what do I do now? I had these things that fit so great, and now
So
they
with
don't
these
fit
new
anymore.
teeth, it stops that.
It stops that.
You say they all have regrets.
Her regret is that she didn't do it sooner. 22 years, and
Do you look at it as she lost out on 22 good years?
I would say that she could have had 22 better years.
That's great.
Let me show you this next one.
All right.
So this is Josh, and he came to us because he had bad teeth, bad gums, bad breath, and dental infection. And he was starting to lose most of his teeth. In fact, Randy, he was down to 1 tooth in the front. Could you imagine eating with only 1 tooth in the front?
Wow. So his option was a denture.
He was told by his local dentist, he lived about 50 miles away from us, that a denture was it. That's the best they could do. And he had his wedding coming up.
Okay.
Which is, in his situation, this is a big deal. He finally mustered up the courage to ask his, fiance to marry him, things like that. And now the big day's coming up and things are getting really bad. He wanted to smile in the photos. He's going to see a lot of his family for the first time. Again, that he hasn't seen in a long time. He wanted his confidence back. He wanted to exude the same kind of energy that his big day and his wife's.
So what did you do for him?
So we were able to remove the teeth, clean up the infection, and give him upper and lower teeth supported by implants that do not come out. Most importantly for him, he came to us saying he wanted to eat. He came to us saying he wanted to smile for his wedding, and I think both of those were very easily accomplished for him. We did it within a month. He had 7 months to go before his big day, and that's because he was so psyched out by other opinions he had that this was going to take a year. This was going to take 2 years.
Okay.
He was pushing off his wedding day. He already canceled a venue 1 time.
Because of his teeth.
Because of his teeth. And that's expensive. That's expensive to reschedule a wedding day. So we were kind of this option for him, an alternative for him that allowed him to resume his life.
Did he ever send you a wedding picture?
Yes. And then smiling, exuding confidence, all as well. Would you say in the after picture that he looks a little more energetic, maybe a little more sophisticated even?
Yeah.
Would you say he looks more attractive, more handsome?
Yes.
Right. Well, teeth make everyone look better. It's not just Josh's case. We've done hundreds of these cases where the before and after, it changes the trajectory of their life. So let me show you this next patient.
All right.
So this is a patient who came to us in the beginning because he had been told by another dentist that all his teeth need to be removed. He actually only had 4 teeth remaining on top and lots of infection. So it was causing him to feel groggy and not like himself anymore. And he lost his ability to chew. So his main focus to us was he wanted to eat the foods he loved, and he most importantly did not want a denture.
Okay.
So if you look at the after photo, would you say that he looks like a different person in that?
He does. Yeah.
Right. Because you think now he's going to eat what he wants, but that was actually a primary concern. He came to me saying, "I only want to eat." But now, if you look at his eyes, so like smiling with your eyes, right?
Yeah.
He exudes confidence. His whole life has changed. He actually tells me all the time that at his job in Southern Illinois, he gets a lot of compliments on his smile. Like, "Where'd you get your teeth done?" They call him Hollywood. That's his nickname now. And that, in the beginning, he wanted something that he could eat with. And now, every time he comes in there, he's grinning ear to ear.
And they're involved on the shade of the teeth and,
Yes.
and the look of the teeth? I mean, you have technology there to kind of give them an idea what
Yes.
it's going to look like?
So we have a technology where we can take photos and then design it and show what it would look right on your face.
Are they surprised when they see it?
Yeah, because I think for a lot of these patients who come in just looking for the ability to eat, they don't realize how much it can affect their appearance.
Are you ever on a consult and they're telling you their hard luck story, but they say they're going to move forward with it, but you get a little excited going, they have no idea how good this is going to be.
Oh, all the time. I think for me, one of those things is like just wait till you see what's next. You know, like
Okay.
I will always kind of in the back of my mind and my team too, because they know, some patients will come in just thinking, I don't want a denture, and that's it. But they don't know all the reciprocal things that are going to happen after.
Like smiling more.
Yes, smiling
increased
more,
charisma.
lighting up a room, attending more of your family
Sounds like an
functions.
exaggeration, but they tell you this stuff?
They definitely tell us this, and I think it gives a lot of validity to the procedure itself. It's more than just getting implants. It's more than just getting teeth. It's going to change the trajectory of your life.
What do you mean by that?
You're going to get more involved in social settings, family events. You're going to smile more. Even just like if you go to a coffee shop and you order a coffee, you're going to smile.
Yeah.
And if you don't have teeth, you're going to frown. And that's
So
going to
people
alter,
treat them differently.
Yeah, you're going to get treated differently. You may even get judged if you have bad teeth. Can you believe that?
They tell you that?
Yeah. Some people won't go on job interviews. Some people won't even go on dates if they have bad teeth. Now, these types of results will change that. Someone's going to get more involved. Maybe they're going to take that risk on a date, have higher intimacy, things like that. So let me show you this next patient. And this patient traveled from 7 hours away for our office. And the reason why she traveled 7 hours away is because her dentist told her that implants were not possible for her. And that is because of her health history, her bone, everything. They just said, we cannot help you. So that led her to do her research. And she was missing her back teeth. She couldn't eat. She's actually very involved in her grandkids' lives and her daughter's lives. And she was starting to shy away from those moments because she couldn't eat in public and she was starting to become self-conscious of not having back teeth. You can see in that photo, there's no back teeth. So someone of her age and her involvement in social settings, you're going out to restaurants. You're going to be around people.
But you can't eat.
But you can't eat. And if you were told that you are headed towards a denture, you're going to start to panic because...
So she's told she couldn't do it.
Yeah.
She does her research. So what'd you do for her?
We gave her upper and lower teeth supported by implants that do not come out.
That looks
She
good.
can eat whatever she wants. She has her back teeth back. In my opinion, she has her life back. And now she can eat whatever she wants. She doesn't have failing, breaking down teeth anymore. She doesn't have infection. She doesn't have bad breath. She has the smile of her dreams. It fits her lower lip. It's very soft. It restores her youth. And I believe this will affect the next 20 years of her life. She sought us out because she was shying away from those social settings like we talked about. So
Now
she'll
she's
spend
back.
more time with her grandkids. She'll spend more time with her daughters. She'll go out to more restaurants. And
They tell you this?
and she'll enjoy traveling more because right after this, they booked a vacation, her and her husband. So they do tell us this. They do report back. They send photos. It's truly rewarding. And let me show you this next patient.
All right.
This is Cynthia, and she had bad-fitting partial dentures. She could not eat with them. She could not chew with them. She only had 6 teeth on the upper and 4 on the lower. That's all your front teeth. You don't
Okay.
chew with these front teeth. You can't. Almonds will break those. You're not biting in.
So that was just temporary, like a bridge type of a
So
thing?
these are removable partial dentures. They may not be
Okay.
full dentures, but they're like think of them as half dentures. And a lot of people get this as like the step before a full denture.
Okay.
So it's kind of like a stepping stone, if you will. Now, if you look in this photo, you can actually see the metal when she smiles. So it actually has a cosmetic appearance too. When they smile, someone's going to notice metal.
Okay.
And it's not natural to have metal on your teeth, showing on display. So what we were able to do was give her teeth supported by implants that don't come out. That metal is gone. Those back teeth are back. She can eat whatever she wants. She can smile big and wide and bright. She wanted to smile big, wide, and bright. That's what she told us at her
Okay.
visit. So we made it happen for her. Look at the change in the color of her eyes.
Yeah.
This is one of my favorite photos. It's kind of like when you wear a color, it brings out your eyes. When we gave her teeth, it brought out her eyes. So that's just one of those things. It exudes a different aura about her.
What's it like when they look in the mirror for the first time and they see their new teeth?
When they look in the mirror for the first time, it's shock, but it's also amazement. I think, the patient has this, they're overwhelmed. They get this rush of emotions. Like they cannot believe this happened. They were so used to their old condition.
Do
Like
they
that
get
was
choked
their
up?
truth. All the time. As a matter of fact, sometimes the family members that are along with them for the journey, or the husband, the daughters, the sons, cousins, you name it. whoever's involved in this journey, sometimes when they come to their follow-ups, they can't believe it either. They're seeing a new person. They're seeing the best version of their wife, of their mom, reborn again. And this is Tom. So Tom was a local fire chief.
Those teeth are bad. Is that unusual to see something like this?
It's really not unusual for us to see something like this. Actually, what's more common is that patients have this and they don't smile, or they're putting their hands
So we don't
up.
see it.
Yes. So there are certain giveaways that people will kind of train their body to do so that you don't really show your teeth. Maybe in a photo, that's just my uncle.
So what was going on with him?
So he had bad teeth, bad gums, and kind of more advanced infection, which is one of those things that really kind of takes its toll on the teeth. It can happen to one and then all of a sudden kind of like domino effect to the other, and it can really get out of control fast. And with him, that's what happened.
So you can't brush or floss it out?
No, it is with you, and it's kind of one of those things that until you get it addressed, it's going to stay there.
So what were his options?
His options were, and we were not the first consult he saw, were to get them all removed and get a denture, as most options could be when you're taking out all the teeth. He also had other options for trying to save them, which that may be one of those things that a lot of patients go through, where it's dumping money into dentistry just for it to fail. And he had done that on a few of his teeth, and he just didn't believe that was going to be
So he kind of had enough.
Yeah, he kind of had enough. It was the money pit. So what did we do for him? We removed his teeth. We cleaned up all that infection. The bad breath went away immediately, overnight.
Okay.
Then we were able to place the implants and deliver him teeth that do not come out in one day, one afternoon.
Looks good.
Looks great. And I think
he really looks like a different guy.
And I mean, if you take a look at his before and after, most importantly his after, one thing that you notice is that it's still kind of a forced smile. And that's one of those things we talked about earlier. It's kind of still not, it still doesn't
like
register.
He's just showing his teeth.
Yes.
Rather than smiling.
Exactly.
Okay,
and this photo was taken a few months ago, but we've seen him on maintenance visits a few times, and we all notice that he lights up our waiting room.
So he's a firefighter.
He's a fire chief, so he's in the public all the time. But he kind of had this appearance of like a very tough person who doesn't smile and is very monotone, kind of very stern looking.
What about now?
It's the complete opposite. He is wearing a smile 24/7. He can't stop smiling. Okay. It's awesome. I think now he can eat whatever he wants. And I bet it's changed his dynamic at work, being that he's a leader of his unit.
Okay.
So now they have a happy boss, a smiling boss.
Okay, good. Time for a few more. I'm going to rush you a little bit.
Good. So here's another case, but this one's a young guy.
Okay.
And what you want to notice here is that those teeth are breaking down. He's got bad gums, he's got bad breath, he's got infection, and he's losing teeth.
And doesn't want a denture.
He was told he was headed straight for one.
Okay.
So now he does his research, he finds our office, and what did we do for him? We were able to actually, believe it or not, we saved up his lower teeth. It doesn't have to be, they all have to go. So we saved his lower teeth, and we actually, on the upper teeth, were able to place the implants to give him teeth that don't come in and out. So we were able to restore some of it and save and rebuild the other half of it. Now look at these photos side by side.
Okay.
Would you say the person in the after is more hireable than the person in the left and put together?
Yeah.
Would you say the person in the after photo is more youthful than the person?
That's true.
Right. Would you say that if you were looking at this picture for the first time, that someone in the after photo or this person in the after photo is more attractive than the one?
Yeah.
Then that's what a smile can do for you. It can change all of those things. A job interview, a date, going out to the restaurant.
So when you say, backing up, you say the trajectory of their life is different, a young guy. You think like in 20 years his life is in a different place because of this teeth.
It changes his whole charisma, his whole demeanor on his day-to-day life.
Okay.
I think that something like this, you put this same patient in a denture in his 30s. He's in a completely different place in his 50s, probably malnourished because he's not eating as well as he should. He's probably not taking the exact chances he would with going and asking his boss for a promotion or going on dates, things like that. So it can really impact the next couple decades of your life.
Because of the confidence.
Because of the confidence, because of the whole aura has now changed of the patient. And let me show you another case.
All right.
And this is a patient who had a lot of bleeding gums, loose teeth, long teeth, and was worried that they were all going to fall out. He couldn't.
For men, do they wait until they're in so much pain before they come in?
I think pain or losing the ability to eat.
Okay.
I think losing the ability to eat is a big one because a lot.
And that was him?
Yeah, and a lot of joy in life. Like it's going out and getting your favorite food. It's going out and rewarding yourself with what you want and what to eat. And if you lose the ability to do that, you start to lose your ability to appreciate life's small things like eating the food you love. And look at that after. I mean, they're natural. They're not too big. They're not bulky. They're age appropriate. They're soft. And they have that masculine kind of straightness.
And you made these teeth in your office?
Yes, we did.
You print those teeth.
And through our software, we designed them for him the way he wanted them.
Seems painful though.
Randy, it's not painful because during the procedure, they're numbed up. Okay. They're sedated. They actually have no recollection of the procedure. And that is why the experience is very pleasant. And the next day, they just manage it with over-the-counter remedies.
Most of them?
Most of them, yeah. Simple ibuprofen, things you'd buy at CVS or Walgreens.
Is this one of those things where when it's all done, they say, doctor, I thought it was going to be so much worse.
All the time.
So bad.
All the time.
Like they worried for nothing, in a way.
And a lot of people will put it off because of that worry. Fear of pain, fear of how they look, fear of the outcome. And most of these people come back to me and say, man, the biggest thing I regret is I did not do this sooner. I didn't overcome that fear.
How soon can they eat?
They can eat within the next day. Now, the diet may change a little bit. You may have to soften things up a little bit. And before you know it, you're eating that steak. You're biting into that apple, the corn on the cob, pizza crust, sourdough bread. All those things that you craved are back. So let me show you this next patient.
Okay.
This patient, she came to us because her teeth were breaking off. She would go out to restaurants and fear to eat because when she would bite into something, not only would her partial break, but her teeth would break off as well.
Is that right? Is that common?
It is very
teeth
common
break like that?
In partial denture wearers.
Okay.
So, in a scramble mode, in a panic mode, she did her research and she found us. And look what we were able to give her. We gave her, and this is, for a side note, this patient is in her 70s.
Okay.
And most people in their 70s are thinking, well, I'm too old for this. I can't do this. And that wasn't the case. We were able to deliver her implants that support her solid zirconia teeth in one day.
Very nice. How old can you be? Like your oldest patient, I think you mentioned earlier. How old?
87.
87.
But
so they're not more likely to fall out if you're 87?
Listen, if you're able to walk into our office, there's probably something we can do to help you with implants. So here's another one I want to show you as well.
Now, she has a decent smile.
Yes, but she didn't like it. She sought us out because if you pay closer attention to this before photo, she's missing teeth. Okay. And they were starting to snap off. So this was work that had been done previously that was starting to break off when she eats.
Okay.
And for someone her age, that was becoming very startling. She has 3 young kids at home. She works in front of the public. It was becoming this, I'm headed towards a denture and I don't know what to do and I don't want that. So she sought us out and we were able to deliver implants that support teeth that do not come out.
So the full arch of upper
and the lower. Looking at the after, her smile has changed. She has a more vibrant smile. Those teeth are designed to fit her lower lip. It's kind of brought back her youthful confidence that someone her age should have. She's a mother of 3.
What does she say? What does she tell you when it's all done?
She's more involved in family vacations. She has spent more time around her kids. She's even been a chaperone on some of the field trips, which she wasn't doing before. But
because
now,
of her teeth, really?
She has more confidence being around kids and other parents and teachers. And before, it was kind of just one of those things where if you start to lose your confidence, you start to shy away from the social settings. You're not going out in public, especially in a community where you feel like other people in the community could judge you. So let me show you this next one as well. So this was a patient, again, who had breaking down teeth, infection, bad breath, bad gums, and was looking for the alternative. She was looking for her solution. So she came to us. We were able to deliver upper and lower teeth that do not come out.
So what are the steps to getting the new teeth, either for the denture wearer or the person you have to do a full mouth of extractions?
So Randy, we have a 3-step process. The first one is your consultation visit. We review your options. We go over your health history. We go over the x-rays and see if you're a candidate. And then we also even discuss financing, give you a treatment plan with all your options right on the first visit. The second visit, if you decide to move forward, is going to be our smile design visit. This is a fun visit. We get to see what's in your future almost. We get to design that smile and then get it all ready to go. So on your third visit, which is your procedure date, we will then remove the teeth, clean up the infection, deliver the teeth supported by implants, and then you will wake up that day, that afternoon, seeing
with new teeth.
The result, new teeth. And then the fourth step, which isn't really a step in our office, is that they're eating out all the time and going back to their social functions and whatever they were being held back from. Usually all resumes in step 4.
Okay, now there's a big trend, and we're short on time, but with these snap-in, snap-out dentures, we had a discussion about this. You've done a few, but you don't like those snap-in dentures. Why?
I don't like snap-in dentures because patients don't like snap-in dentures. What may seem more convenient for both of us in the immediate is actually more inconvenient for us in the long haul. They break. they get damaged. They get lost. You can lose your teeth still because they come out every night.
Now, we talked a little bit about this in the green room, and you said somebody just texted you
This
and
morning.
they broke their snap-in.
This morning, can you believe it? They broke their snap-in, and we're out of town, and now you got to go the weekend without.
So it's better than a loose-fitting denture.
It's still a step in the right direction, but it is not a permanent solution. They can break, they can get damaged, and I think it's a good stepping stone to eventually get you to implant-supported teeth.
So it's a little bit more to go the teeth that don't come out.
Yeah. Initially, it is inexpensive to do overdentures or snap-in dentures, but in the long haul, it's not. They're actually more expensive because they break. They need to be remade, relined, refitted. The new guys like to do snap-on dentures, and listen, early in my career, I did them as well. You have to start somewhere.
Is it easier? Is that why?
It is easier. It's less technique sensitive, and it's one way to get your patient out of a denture. But in the long haul, they break. They require maintenance and relines, and it drives up the cost to the point where.
So you always want to go upper and lower teeth that don't come out.
Yes, and if you would have just done that the first time, you're probably going to spend less.
Okay, good. Time for one more photo.
So this is another photo I brought for you today. And this is a patient who, as you can see, they're missing very crucial teeth in the front of their mouth, which means they don't smile. As a matter of fact, this patient told me she doesn't smile and she wants her smile back. That was why she came. Now, eating was secondary, but she doesn't smile. And to a person who's now retired, traveling more, getting more involved, has more time outside of work and wants to be social, that's devastating.
So what did you do?
So we were able to give her upper implants and teeth that do not come out. Teeth that restore.
That's a pretty smile, by the way.
If you look at it, we designed it very youthfully. She wanted youthful. She showed us a picture of when she was 18 and said, make it look like this, which is a challenge, but we got it done. So we were able to follow that lower lip. If you could tell, it just is flush with her lower lip. Still learning.
And this is done on a computer.
Yes.
Is that why you're able to do it?
Software.
Okay.
So our software, it's almost like kind of AI, advanced technology. We can kind of show you what it will look like before you even commit, which is good, right? It's what you'd want. Now, if you look at this before and after picture, look at the corners of her mouth. That is a forced smile. That is someone who never smiles. Look at the difference.
Yeah, it's
The
big.
difference is profound.
It's big.
That is someone who can't stop smiling and someone who doesn't even know how to do it. So we were able to give her exactly what she wanted.
We're out of time. Two groups of patient watching this. The denture wearer, the people that have teeth but they have to come out, but they don't want a denture. They're watching this. They've heard what you have to say. They're still skeptical. What do you say to them?
I invite them in to come check out their options. I think you may not know what's waiting for you and what's ready to change your life.
Do they get to see you on the consult?
They do.
Okay, good. One last thing I had to bring up. So I guess Medicare, Medicaid, dental insurance doesn't really cover this, but you say people finance this.
And dental insurance only gives you like $1,000 to $2,000 right off the top. And then these are relatively expensive procedures. So we will offer convenient financing options in office right at your consultation visit so you can have all the options laid out right in front of you.
Okay, good. I want to thank you for coming on the show. And if somebody wants to make an appointment, do they go online and make an appointment, or you prefer just call your office?
You can call our office. You can make an appointment online. You could send us an email. We're super responsive and we'll take care of you right away.
I want to thank you for coming on the show. Good
Thank
stuff.
you.
You're watching the Wellness Hour news that makes you healthier. For now, I wish you good health.